11 additional COVID-19 deaths has pushed this country's death toll for the month of May to 66. The Ministry of Health is also reporting 615 new COVID-19 positive cases. Among the deaths are 3 elderly males, 3 elderly females, 2 middle-aged females, and 1 middle-aged female, all with comorbidities, as well as 1 middle-aged female and 1 adult female without comorbidities. According to the latest update, the 615 positive cases reported today, Wednesday, reflects samples taken during a 5-day period, May 7th to May 11th, and not the last 24 hours. Total active COVID-19 cases now stand at 4,588, with 343 patients at hospital. The Ministry of Health says it should be underscored that the cases tested reflected a positivity rate in excess of 40%, which is a cause for significant concern. As such, the population is urged to follow all the personal health guidelines to avoid becoming infected or spreading the virus. Although occupancy levels have decreased at hospitals which house COVID-19 patients, epidemiologist Dr. Avery Hines is still urging the public to follow all COVID-19 health measures. This comes as additional beds have been added to the parallel healthcare system, and the U.S. government has also donated 2 field hospitals. Kimberly de SOUZA has more in this report.
Occupancy levels in the ambulatory ward have decreased to 41%, but the country is not out of the woods just yet. Epidemiologist Dr. Avery Hines shared the figures during Wednesday's COVID-19 health update, adding that the high dependency unit has a capacity of 93%, while the intensive care unit has a capacity of 74%.
The decrease in the occupancy is really because of the increase in the total number of beds being counted. We still want to emphasize that as new cases are being diagnosed, these people are ill, they continue to need hospital care, and that this is an interim step, but it's not a be-all and end-all solution to the occupancy concern.
Dr. Hines said over the past few days, an additional 130 beds have been added to the parallel healthcare system. One of these facilities is UTT's VALSAYN campus, which has been converted to a 4th-level step-down facility. Meanwhile, General Manager of the North Central Regional Health Authority, Dr. Abdul Hamid, said the purpose of the facility is to reduce the capacity of the parallel healthcare system and to decant patients from major COVID-19 facilities.
This facility includes 40 beds with pure oxygen tanks for each respective beds. 32 patients currently quarantined at the facility, and it's expected to reach 40 patients by midday, with an anticipated 15 discharges to home.
He said there is medical equipment, including crash carts, resuscitation equipment, and medical supplies.
Patients will be discharged from the hospitals with mild to moderate symptoms. Oxygen requirements 5 liters per minute. So in concept, this is an oxygen therapy step-down unit. Ambulatory care level 5, which means that the patient can do most things for themselves with minimal input. Minor acuity care level 4.
He said patients usually stay at the facility for approximately 3 days, adding that the facility also houses pharmaceutical supplies to prevent patients from going to pharmacies. Dr. Hamid said a similar facility will be available at Point Fortin. To aid in this country's occupancy levels, the U.S. government has donated 2 field hospitals with a capacity of 40 beds each. Epidemiologist Dr. Avery Hines said they can offer both ICU and HDU support services. While they are not yet operationalized, they will be used on an as-needed basis. Kimberly de SOUZA, TTT News.